New worries this Thanksgiving holiday week. The White House is putting a final chokehold on free market health care. The government now telling health insurers how to spend their money, and if they don't listen up, they have to pay up. Is this a code blue for private care in America? Hi, everybody. I'm Cheryl Casoni. Welcome to Cashin' In. Our Cashin' In crew this week: Wayne Rogers, Jonathan Honig, Tracy Burns, Charlie Gasparino, along with radio talk show host Mark Levine. Welcome to everybody. Okay, the White House, guys, now telling health insurers to spend 80 to 85% of their premium dollars on medical care. If not, they have to pay a rebate that could cost the industry nearly $1.5 billion. Now, Tracy, you say this adds up to a government takeover of health care.
Cheryl, yet again, we're hearing the government tell us how to spend corporate America's money. They're cutting into profit margins. This is going to reduce physician pay. This could shut down hospitals at the end of the day. This is a mess. The government needs to back out. We saw states try this. Kentucky, North Dakota, they tried to do this. It did not work. The government needs to stay out of the way.
You know, Wayne, I have to say, I mean, these premium changes, I mean, if you look at studies that have been done in the past couple of years ago, Wayne, most insurance companies were already spending about 80% or so of profits on healthcare costs. So how is this any different what the government's trying to mandate now?
Well, what's different about it is the government is trying to do it. That's what's different about it. The federal government is going to stick their nose into all of this kind of stuff. Look, you got a health care bill that's 2,500 pages long. The people who voted on it didn't read it. The people who are administrating it don't know what's in it. And it's a typical government takeover of something where nobody knows what's going to go. By the way, it's a law, and the law is not even set yet. In other words, they've got a lot of bureaucracies that are administering this. There is no tort reform. There is all of these problems with it, and it's just going to be a mess. It's going to be a giant mess, and we'll pay for it for a long time.
And no cost control, Mark Levine. That's the other issue. But all of this does begin January of 2011. The government says it's about transparency, but is this about the government putting their fingers further into insurance companies' business?
Cheryl, you say there's no cost control, forcing health insurance companies to spend at least 80% of what they get on health care. That is a cost control. You know, I don't really find it that shocking that we're making health care companies pay for health care. I know that some of you think that's socialism, but to me, it's kind of like making the ice cream truck actually provide ice cream. And it's nice to know in this Christmas season, when all of us are looking out for Tiny Tim and trying to make sure he can walk, the Cashin' In crew is looking out for Uncle Scrooge.
But let me take this to Charlie Gasparino, because look at PricewaterhouseCoopers did a study, and this is 2 years ago, Charlie. They found that basically 87% of profits of money went back to patients. I mean, that's an overall figure. You can debate whether this is up or down depending on the states, Charlie, but that's what
Mark, I actually know some doctors. My brother's a doctor, and when Tracy said before that it might close some hospitals, this will close hospitals. These hospitals right now are operating on very thin margins. Mandates like this and other mandates will close down hospitals across the country. I mean, that's what you're going to get. You want socialized medicine? Well, the government's going to be taking over all these hospitals.
Jonathan?
Right, and who's surprised? I mean, the president campaigned on this. Go back to 2008. The goal of the left for years has been socialized health care. Call it a universal care, call it whatever you want. It's socialized care. They believe you have a right to care. That right is paid for by someone else. And Mark, you're right. It is force, that is the use of government, which institutes that care. The ironic thing, Cheryl, is that the more government's gotten involved in health care, going back to S-chip and C-chip and Medicare and Medicaid, go back to the New Deal, the more involved they've got, the more expensive, of course, the worse care has become. This puts the final nail in the coffin of free health care in this country.
And Cheryl, where do you draw the line on, the true government takeover? If they say these medical loss ratios have to be 90%, is that officially a takeover? I mean, we're at 85 now. Where are we going with this? You can't get your hands any more further in the pot than the government is right now. And you're going to see it affected in our physicians and our hospitals.
And Mark, if insurance companies don't comply with this 80 to 85% range here, they're going to be fined for 2012. And you could argue they're not that profitable as it is.
Now, you said most companies are already providing this range. The ones that are actually providing care to the American people have nothing to worry about. The ones that are taking all the money from Tiny Tim and giving it to Uncle Scrooge, they do have something to worry about.
Can I just say, I am so
doubled
sick.
every 10 years.
Yeah. Let me just say, I'm so sick of those ad hominem attacks. If you don't vote for socialized health care, you're Uncle Scrooge? I mean, Mark, is that what your whole philosophy is based
Jonathan,
on? Ad
We're
hominem
talking about-
attacks?
we're talking about at
Industrialized
least
nation in
60,
the country,
you know,
except us,
70% of
provides
the,
decent health
I
care to
would say at
people.
least 2/3 of the country is Uncle Scrooge these days.
Yeah, big time.
I mean, there's a reason for that.
That's not true.
And
Most
all
of
the
the country
doctors.
actually needs
You know,
healthcare,
here's
or
the
they'll
thing,
die.
Mark, I haven't met a doctor
How about
that
Thomas
supports.
Jefferson, not Uncle Scrooge? I mean, how about,
Okay, what?
Abraham Lincoln, not
Bah
Thomas
humbug.
Scrooge?
Wow, we just had Thanksgiving and already we're like, going back to bah humbug. Anyway, Tracy, back to what we were talking about earlier, and that is that, in a way, all this transparency, the fines, the rules, do you think in maybe, say, 2 years, 3 years, that we do have socialized medical care because that's truly what the government wants to do here?
I mean, look what's happening. Say bah humbug all you want. We've made an attempt to vote them out in November, right? Everyone is making a statement here. Everyone voted on people who were going to repeal this. Look, Sheriff, you don't know where this is going to go, but we're already hearing them back off the notion that they're going to make everyone file 1099s. We've talked before about the 111 waivers that companies are getting because they can't really handle things right now. I mean, it's an admission of fault and guilt, and we might start to see this go away.
This is a huge political story for the president. You remember what happened with Bill Clinton? Bill Clinton lucked out because health care did not get passed. This albatross is going to be around President Obama's neck until right through to 2012.
Sure.
And because he did pass it. And the people,
Sure.
and by the way, most of the country does not like it.
That's right.
And yes, you're going to see these mandates. And yes, you'll see hospitals close all on his watch.
But Wayne, at the end of the day,
no.
but Wayne, we do have a law. This does go into effect January of 2011. It's right around the corner, and Congress did agree on this, Wayne. I mean, this is what we have.
Well, it is what we have, but it could possibly get repealed. The biggest problem with all of this is the one that we talked about early. There is not one thing, and Mark, you cannot give me one, where the government has gotten into the private sector and done anything that is really efficient and is helpful to it. Competition in the free
Wayne,
market
I'll
is
give
what
you
gives you
30.
the. Let me finish, please. Competition in the free market is what brings you the best service and at the best price, not the federal government messing with it, who constantly bloats something way out of existence, and we have to pay a fortune for it, and that's why we're always in debt.
And Mark, it doesn't really do anything to deal with fraud. I mean, that's a whole nother topic, a whole nother show, Mark, but that's not even addressed
Actually,
in
it does.
this issue.
But Wayne, look, you talk
And by
about
the way,
the government
fraud is
can't do it
rampant
right.
in the federal
every
government.
other industrialized nation on earth, they do it this way. 30
Yeah, and they have
industrialized nations,
14,
they
50%
spend
unemployment.
we do,
Oh,
and the
they
people
also have a lot
does that
larger
make it
unemployment.
longer? Why does every other
Mark,
country on earth know
Mark,
what
they
to do,
all
and
have
we Americans
they
can't
all,
figure it out?
Mark, and they all have massive
Mark,
unemployment. Structural unemployment.
just because everybody else is doing it does not make it right. That doesn't make it work.
They live longer.
Consensus
Mark,
is
last
not,
word. Mark, last
necessarily
word.
the right rational answer.
Mark?
They all live longer than we do. They all do it at half the cost. I think they figured something out. The other people, I don't think Canadians are necessarily smarter than Americans.
Sure.
They get better care at half the cost.
Yeah, oh, please.
All right.
They all come here
That's
for
why
health
Greece
care.
is broke. That's why Portugal and Spain are going broke. That's why all of those countries over there, yeah, they figured it out all right. Please, give me a break
If
here.
the private industry can compete, God bless them, let them compete. If they can't compete, then there may be a better
Walmart
way to
is
do
doing it.
All right, guys, we're going to leave it there.